Hi, I'm Leanna.
I'm Olivia.
I'm Anna.
I'm Jessica.
And I'm Joanna.
And we're nursing students here to teach you guys nursing students about the importance of vaccines and how important they are for promoting health both individually in our patients and in society as a whole.
Vaccines can be divided into two broad categories: non-living vaccines and living attenuated vaccines. Live attenuated vaccines contain a weakened version of a living microbe. It elicits strong cellular and antibody responses, as well as long-lasting immunity with only 1 or 2 doses. However, one big downside of live attenuated vaccines is the chance that it could mutate back into its live form and cause disease. Examples of live attenuated vaccines are polio, rubella, measles, and chickenpox. Non-living vaccines are disease-causing pathogens killed through heat, chemicals, or radiation. Unlike live attenuated vaccines, the microbes can't mutate and cause disease, so it's a bit safer than the live attenuated vaccines. However, it stimulates a weaker immune response and usually requires 1 or 2 booster shots. Examples of non-living vaccines include typhoid, cholera, influenza, and the plague. These vaccines are from extracts of the pathogen, proteins from the pathogen's cell membrane, or purified recombinant proteins. Diphtheria and tetanus vaccines are from purified toxins secreted by pathogens. The toxoids are then treated with aluminum salts before injection. Adjuvants are ingredients in the vaccine that help enhance its ability to protect against infection. It reduces the numbers of doses an individual may need to achieve full immunity. It also enhances effectiveness in very young and older adults, as well as immunocompromised people, by boosting antigen responses. Monophospholipid A and aluminum are both common adjuvants found in a lot of U.S. vaccines. The approval process of vaccines is regulated by the Food and Drug Administration. It consists of 3 phases: initial human studies, dose-ranging studies, and documentation of effectiveness. The first phase, initial human studies, studies the safety of the vaccine and the immune responses on a small number of subjects. The second phase, dose-ranging studies, studies different doses to test what dose works best. The third phase, documentation of effectiveness, is where thousands of individuals are assessed for the effectiveness and safety of the vaccine. At any stage, if there are significant concerns about the safety of the vaccine, the FDA may stop any ongoing studies or request more information in order for the study to continue. A lot of vaccines undergo phase 4, which tests for adverse effects and other safety concerns for the vaccine. So the World Health Organization has compiled a list of 6 common misconceptions about vaccinations to try and dispel false beliefs about vaccinations. Number 1 is diseases had already begun to disappear before vaccines were introduced because of better hygiene and sanitation. So there's no doubt that better living conditions and knowledge about nutrition has reduced the prevalence of certain diseases, but vaccinations have also had a significant impact in reducing the incidence of diseases as well. For example, the real permanent drop in measles incidence is due to the measles vaccine, not any other factor. Number 2, the majority of people who get diseases have been vaccinated. No vaccine is 100% effective, and some people may never develop immunity after receiving a vaccine. This factor coincides with the fact that most people in the US are vaccinated, and as long as that remains true, herd immunity will protect the general population. Number 3, there are hot lots of vaccines that have been associated with more adverse events and deaths than others. Parents should find the numbers of these hot lots and not allow their children to receive vaccines from them. So an adverse report does not necessarily mean that it was caused by the vaccine. Vaccines are known to cause minor side effects like soreness or fever, but there is little evidence linking vaccination with permanent health problems or death. Also, vaccine lots are not the same and may vary from several hundred to several million. Thus, a large lot will have more incidences of adverse effects. Number 4, vaccines cause many harmful side effects, illnesses, and even death. Not to mention possible long-term effects we don't even know about. Once again, most adverse effects from vaccines are very, very minor. The chances of severe adverse effects from vaccines are 1 to 1,000 to 1 million people, which is quite rare. As for deaths, there is very little evidence suggesting that vaccinations have been linked to death. Number 5, vaccine-preventable diseases have been virtually eliminated from my country, so there is no need for my child to be vaccinated. Though vaccines have reduced most vaccine-preventable diseases to very low levels in most countries, there are still countries in the world that have a high prevalence of certain diseases. High incidences can spread to other countries through travel. So vaccines not only protect individuals, but also those who can't get vaccines or don't respond to vaccines as well. Number 6, giving a child multiple vaccinations for different diseases at the same time increases the risk of harmful side effects and can overload the immune system. So studies have shown that getting multiple vaccines at the same time does not increase adverse effects as getting the shots one by one at different times.
So this slide is on herd immunity, and vaccinations are one of the greatest life-saving developments in human history. And this can be seen by the great public health achievement of the eradication of smallpox. And since a large amount of people were vaccinated, now smallpox is completely eradicated. Additionally, vaccines have also led to the near eradication of polio and a reduction in measles death by nearly 80% since the year 2000. So that's a large amount of people that have not been infected by measles. And the World Health Organization recommends that 93 to 95% of people should be vaccinated in order to provide herd immunity against measles. And recently there's been an increased amount of measles outbreaks in the media. And this is really important to not only the individual themselves, but the entire community. And so basically what herd immunity is herd is a large amount of people, and immunity is the ability of our body to fight infection. And so vaccines help eliminate the amount of people catching the disease. And so basically in this photo you can see that the blue people are people that are not immunized but are still healthy, and the red are people that are not immunized and sick and contagious. So as seen in the first photo, when no one is immunized, that contagious disease spreads through the population rapidly. And in the second photo, some of the population gets immunized, and the yellow are people that are immunized and healthy. However, the amount of people is not adequate enough to prevent the spread of disease throughout the population. And so basically, the most important thing about herd immunity is that when a large amount of people are vaccinated, this helps prevent infection for people who are immunosuppressed. For instance, individuals that have AIDS or HIV cannot receive vaccinations, and as a result, they need to rely on the majority of their community being vaccinated in order to prevent their susceptibility of infection. And so in this photo, this is what happens when an entire community gets vaccinated. And so the yellow are people that are immunized and healthy, and the red show people that are not immunized, sick, and contagious. So these are the vulnerable populations that cannot receive the vaccine, such as younger children who simply cannot get it, individuals with HIV and AIDS, and also individuals that are allergic to vaccinations. For instance, people that are allergic to eggs cannot receive the flu vaccination and therefore need to rely on the rest of their community to be immunized. And a good example of an emerging issue is pertussis. And basically, since the immunity fades over time, if vaccinations in the community fall, people who have not been vaccinated are more susceptible. So basically, it's important that the community has this as a whole. In order to prevent infection, a large amount of people need to be vaccinated, and that's why it's so important that everyone is vaccinated.
So now we're going to discuss the prevalence of vaccines in older adults. So we looked at a systematic search that was conducted by Biomed Central Public Health, and they looked at studies to see what the social determinants and barriers were to older adults receiving vaccines. So 3 social determinants that they identified were socioeconomic status, cultural and health beliefs, and education. So first we're going to discuss socioeconomic status. So the study found that in the United States, older adults with lower socioeconomic status reported lower rates of vaccinations. And that could be because these older adults may not have as much access to preventative health care, which includes vaccines. And in contrast, older adults with higher socioeconomic status had higher rates of vaccinations. So now the second factor that they identified is cultural and health practices. And the study found that older adults who have been previously vaccinated had a higher rate of vaccinating themselves as older adults as well, and also encouraging their families to get vaccinated. And this could be because they value protection of the family, and that also goes along with herd immunity. That if more people in the population vaccinate themselves, they can protect other people in the population who maybe can't get vaccinated. So in addition to culture being a positive factor in determining if an older adult will get vaccinations, it can also be a hindrance as well. And we have two examples of these. So the first example is that some cultures value indigenous health practices. So instead of seeking medical care and getting a vaccination, they might take other health practices that are more holistic in order to prevent the spread of diseases. And then the second example we have is some older adults who are African American have decided not to vaccinate themselves because of mistrust in the healthcare system, and this is related to the Tuskegee trial. So in the Tuskegee trial, it was a group of researchers that looked at African American men who had syphilis, and during the study, an antibiotic was discovered that would treat the disease. However, the antibiotic was withheld from them because of the study itself. So these African American men have mistrust in the healthcare system. And another factor that influences the decision of older adults in getting vaccines is education. And this includes education level as a whole, and then education on vaccines as well. So the systematic search found that older adults with higher educational achievements had higher rates of vaccinations. And this could be because they have more confidence in asking their physicians about preventative health care, and also because they have more access to this health care as well. This relates back to older adults with a lower socioeconomic status, because these people may have less access to vaccinations or health insurance, and they also may have lower health illiteracy. So as nursing students, we need to take this into consideration because we are educating our patients and their families about vaccinations and how vaccinations can help protect ourselves from disease and also other people in the community as well.
So I'm going to talk a little bit about vaccines in children. So vaccinating your kids is really important because it protects them from a bunch of deadly diseases. And so it's really important to vaccinate kids only because they have a weaker immune system based on their age, and they're in a lot of environments that they're very susceptible for infectious diseases such as schools and daycares. So there's a really big difference in vaccines now and before. So before, when we didn't have vaccines, there were a bunch of cases of different infectious diseases. And here we have an infographic that demonstrates that example, but in measles. So here in 1960, prior to the vaccination era in the United States, there were 48,000 hospitalizations just because of measles. We have 400 to 500 deaths per year due to measles, and 4,000 suffered encephalitis, which is swelling of the brain. It's a side effect of chronic measles and is usually fatal. So those are very big numbers compared to today, where a lot of people don't know what measles is, or they haven't seen it, and they're not really aware of the severity that the disease can be and the side effects that it can cause. And so here, the CDC has collected data that basically demonstrates what it has been like now without the vaccination. So here we have, in 2002, for example, the cases of measles were below 50. And so this is kind of consistent throughout this whole timeline. In 2004, there were even less than 50. And it has, again, stayed consistent until recently when people have begun not immunizing their children, and they have begun not really understanding why these vaccines are so important. So this began about 2011 and really increased in 2014 when 603 reported cases of measles were prevalent between January 1st and October 31st. And that's only the first 10 months of the year. So that's not even the full year. So that's a very, very big number that, again, people haven't seen before, and they're really not aware of why measles is so important to prevent, because it can be so deadly. So from this chart, we can understand that we can see how no vaccines, the lack of vaccines, increases the prevalence and the susceptibility for all people in our community. So a solution for parents who are a little bit less adamant to get their children vaccinated is a solution called combination shots or combination vaccines. And what combination vaccines are they combine vaccinations to provide immunity for more than one disease. But we have some examples here. We have Pediarix, which combines DTaP, hepatitis B, and IPV, which is polio. We have ProQuad, which combines MMR and varicella, chickenpox. And we have Kinrix, which combines DTaP and IPV, polio again. And so one great phrase that a lot of providers like to use is more protection, less shots. So again, it's talking about that idea that you can get more immunity with only a couple shots. And so with these couple shots, it decreases the side effects of vaccines, such as muscle aches or anything else you can get from those individual vaccines, and it provides a lot less stress on parents and children. And so it reduces the need for multiple pokes, it provides a less intimidating environment for both parent and child. And so with combination shots, there's a greater chance that kids will get immunized on time, just because it is much more convenient to get it all done in one appointment. It's much easier to keep track of by the provider, and a lot easier to keep track of by the parent. There's a lesser chance that the child will miss school based on doctor appointments, and again, you don't want to increase any chances that they won't get immunized. And so one point that providers want to make sure parents know is that safety is always ensured with combination shots. They go through the same processes as normal vaccines to make sure that no immunity is compromised based on the fact that they're mixed together, that they're safely mixed together, and they're safe when they enter the human body. What would you do if your child is not immunized? So if you don't choose to immunize your child, there are a few precautions that you need to make sure that you take. And so you need to realize that there are still diseases in our society today, such as whooping cough, chickenpox, or influenza. So it's really important to remember that just because you don't see them and they're not as common, doesn't mean they're not there. And just like with measles, like we said before in our infographic, just the increased use of vaccines will decrease the amount of cases in our society. So again, we want to use these vaccines to protect our public health and everyone in our community. And so another point that you always want to make sure that you are aware of is traveling. So traveling to a different country, you're putting yourself at risk for susceptible diseases because you're out of your routine, so you increase your stress levels, and your immune system tends to suppress a little bit, so it's not as strong as usual. So you always want to make sure you're aware of that. You're going into a place that with different health protocols, and so if you go to a different country, you're not in the same environment as you are here in the US, so you always want to make sure that you keep track of that and are aware of what you're doing. Another point you always want to make sure that you remember is that you have a chance, your child has a chance of being made to stay home from school to protect the people around them and protect the community that they are fostering there at that school or daycare. And so you want to make sure that if your child gets sick, or if anyone else in your school, in the school gets sick, you want to protect your child and everyone else around. So if you end up going to the hospital, if your child ends up going to the hospital, you always want to make sure you tell medical personnel. You want to take care of these medical personnel because you're going into a facility like a hospital where there are a lot of vulnerable patients with these diseases, and it's a very sensitive environment.
Although there are many factors that affect whether or not a parent decides to vaccinate their children, there are three that have been very prevalent in the research studies done. The first factor is the parents' lack of education and awareness on vaccinations. The second one is healthcare professionals' recommendations and support. And the third one is family support. So looking at the first factor, which is a parent's lack of education and awareness on vaccinations, there was a study done looking at parents of 6 to 23-month-olds and looking at whether they decided to vaccinate their children or not, and then deciding what were the factors in that decision. And so in particular this part of the study, they looked at the parents who decided not to vaccinate their children and asked them some of the reasons why. And the foremost reported reasons were that they weren't necessary, the baby's too young, that the child is already in good healthy condition, and that they were worried about the side effects of the influenza vaccine. And so from this we can tell that parents are unaware of the importance and positive health implications of vaccinating all children, including those who are healthy. Because today in society, there's lots of illnesses and diseases that these healthy children are still susceptible to. And so really vaccinating these children is the only way that parents can take control of their children's health and then also keep them in their best health and let them reach their best health potential. And so also from this, we can see that parents are not aware of the progression vaccines have gone through. They're a lot safer than they may have been in the past. And now a lot of times the benefits do outweigh the risks associated with vaccinations. And also, yes, there are some vaccines that are not appropriate for younger children, but in the case of influenza vaccine and a lot of other ones that are given to the younger children, they are safe and they would not be on the market for younger children if there's any warning or precaution that need to be taken with them. And so moving on to the second factor, which is our healthcare professionals' recommendations and support. In that same study that looked at the influenza vaccines for our 6 to 23-month-olds, they did another part where they asked them if they'd ever received a recommendation from a healthcare professional or healthcare provider about getting their child the influenza vaccine. And so out of talking to all the parents, they found that only 10.6% had ever received any type of recommendation about getting the influenza vaccine for their children. And so from that left an 89.4% without ever receiving any type of recommendation to look into this vaccine for their child. And so from that, they took those parents who had never received any type of recommendation from their healthcare provider or professional and went and asked them if they were to receive this recommendation, would they be more likely to vaccinate their child? And from that, they found that 90.2% said they would have been more likely if they had received that healthcare provider, professional recommendation and support of getting that influenza vaccine for their child. And so in a secondary study that was focused on HPV vaccinations, and this was obviously focused on older children, as it is the older children who usually get this vaccine, but this study instead focused on the parents who had decided to get this vaccine for their children, and then asked them the reasons why or like what helped in that decision making. And so for them, they reported that it was going to the trusted provider and having that trusted provider or health professional introduce it and recommend it to them. And so when they talked with these parents, they found that none of the parents really went in with this shot in mind. They never went to their provider and were like, I am here so that my child can get this. It rather came about because the healthcare provider or professional introduced it to them and gave a strong recommendation. This was a big part of it as well. The parents reported that when the provider had a strong recommendation, rather than a weak one, where they made it a priority rather than something that was more optional, they were a lot more likely and felt a lot more comfortable as they understood the need of getting this vaccine for their child. In this study, they also found that the parents reported that they have a reliance on their healthcare professional's opinion for their child's health, and that they rely and trust in what their provider feels is the best choice for their child. And so from this, we can see that there is clearly a strong need to increase the awareness of healthcare professionals and future ones like ourselves to the impact our recommendations and support playing the vaccination choices of our younger children. Because especially with our younger children, they are under 18, so in that older range, even if they want the vaccine and the parents may be against it, it's up to us to really introduce and educate why it is important and why it's a good measure for them to take in their health promotion. And so moving on to the third, which is family support. In that same study that focused on the influenza vaccine in our 6 to 23-month-olds, they found that 72.6% of those parents who chose not to vaccinate their children would have done so if they had had family support. And so the researchers found in this study, and they accredited to this finding, to this psychological theory called this theory of planned behavior. And what they say underneath this theory is that support obtained from significant others in performing a health-related behavior is called subjective norm. And so the researchers explain that subjective norm has been used to explain a lot of different health behaviors, and it's because It's the idea that it's an important determinant of behavioral intention. And what this is our plan to perform a health behavior. And then this leads on to our actual performance of the behavior. So if we have that family support of telling us, hey, like you should really consider getting this vaccination for our grandchild or so on like that, that's giving that support, that reinforcement of why the vaccine is important. They then implement that into their plan of getting that vaccine for their child, which then leads to the performance of ultimately getting the vaccination for their child.
So this slide is on health promotion immunization interventions.
So there are many ways to get communities to get vaccinated, and one of them is predicting health behaviors of individuals and their probability of getting vaccinated. For example, a study found that college students have a high risk of getting the flu even during non-pandemic years. So the researchers found that college students' beliefs on vaccinations, as well as having a history of receiving the vaccine, influences their decision on getting the flu vaccine. This result offers potential interventions by public health and university health professionals in expanding the focus of flu vaccination to high school students and their parents so that incoming freshmen have a higher vaccination rate. Also, educating students about the flu vaccine can also be beneficial, as protecting vulnerable members of the community also showed increased intentions of getting the flu vaccine.
In the next study we found, they evaluated targeted text message reminders to low-income urban parents to promote influenza vaccinations among children and adolescents. And around 1,200 individuals participated in this study that were ranged from ages 6 months to 18 years old. And so basically in this study, the parents received 5 weekly text reminders of educational info regarding the influenza vaccine and regarding Saturday clinics. And so compared with usual care, text message reminders was associated with an increased rate of influenza vaccination overall. And however, the influenza rate remained low. And so despite the availability of the influenza vaccination, infection results in an estimated of 31 million outpatient visits and around 200,000 hospitalizations and 36,000 deaths each year. Vaccinating children and adolescents against influenza has been shown to be cost-effective. However, influenza vaccine coverage nationally remains very low. And like Joanna said, this can be due to a variety of factors such as their belief on vaccinations and history of receiving the vaccine. Since college students have a high risk of getting the flu due to crowded living situations, and especially during non-pandemic years, I think that a good intervention would be to use technology to target other students to get immunized against the flu. So in today's society, technology is very prevalent in our lives, and a simple text message reminder could influence students to get vaccinated. Since we have access to technology through the university, this could reach a large amount of people and would be at a low cost. At school, I know that without my parents, it is less likely for me to prioritize getting vaccinated, so a simple reminder could help me and others who have simply just forgotten to get vaccinated.
So this is the handout that we created to summarize the points of this presentation and to show how vaccines can promote health. So in this first image over here, as Jessica explained, the top part, the blue people represent people who are not immunized, and the red people are people who are sick and contagious. So disease spreads quickly and widely throughout the population. Then the last situation down here, the people in yellow are people who are immunized, and you can see here that disease doesn't spread as widely through the population because these yellow people are immunized. So these, down here we have 3 main factors that it's important to remember about vaccines. So the first one being vaccine safety. Vaccines are approved by the FDA because they have more beneficial outcomes than adverse effects. And then the second important thing to remember is health promotion. So it's important to encourage family members and friends to get themselves vaccinated and their children vaccinated also, and that also goes along with herd immunity. Then the third point to remember is education. So it's important to ask questions about vaccines so we can learn more about them and be more confident in them when we do get them. Then on the right side of the handout, we just have some more interesting facts. So the first one states that 60% of parents in a systematic study reported vaccinating their children in order to protect other children in the community. And this really goes along with herd immunity. It demonstrates that these people were probably aware that vaccinating their own children not only protects them and other children in the community as well. The second point we have right here is about debunked misconceptions. It states that 1 in 1,000 to 1 million people may experience a serious adverse effect from a vaccination. So this goes along with what Joanna said, that there are many misconceptions about vaccines, but it's important to remember that the benefits do outweigh the risks. Then the last point we have down here states that 90.2% of parents would report that they would likely vaccinate their children had there been more support from their healthcare professionals. And that's important for us to remember as nursing students and future healthcare professionals, that we have a great impact on if parents decide to vaccinate their children. And then we also discussed older adults and how they can make their decisions based on their past and if they've been vaccinated before. So it's just important to keep these in mind, because vaccinations are important in promoting health, and we can use vaccinations to protect ourselves from diseases and the rest of the community as well.
We hope that what you have taught you today will help you in your future nursing career.
Thanks for watching!
That was good.